What if I told you that millions of Americans are living with a blood sugar problem right now, and most of them have no idea? Not because they're careless, not because they eat too much sugar, but because the earliest warning signs of prediabetes are quiet, subtle, and incredibly easy to ignore. In fact, some of these signs are often dismissed as normal aging, stress, or just a busy lifestyle, and by the time blood sugar finally shows up as diabetes on a lab report, the damage has often been developing for years. I'm Dr. Nimra Raza. I'm a physician, and on this channel, we talk about health through the lens of metabolism, hormones, inflammation, and long-term disease prevention. According to clinical data, more than 1 in 3 American adults has prediabetes, and the majority don't know it, not because doctors are hiding anything, but because prediabetes doesn't usually feel dramatic. It doesn't announce itself with pain or emergencies. Instead, it whispers. Prediabetes is not simply a little high sugar. It's a state where your body is already struggling to manage glucose efficiently. Insulin, the hormone responsible for moving sugar from your blood into your cells, starts to lose its effectiveness. Your pancreas compensates by producing more insulin. Blood sugar may still look almost normal, but metabolically, the system is under stress. This is where most people get it wrong. They think, my labs aren't that bad, so I'm fine. But prediabetes is less about one number and more about how hard your body is working behind the scenes just to maintain balance. Let's start with one of the most ignored signs, persistent fatigue. I don't mean being tired after a long day. I mean waking up tired, needing caffeine to function, and still feeling drained by mid-afternoon. Many people blame stress, sleep, or age, but biologically, this often comes down to impaired glucose utilization. Your cells rely on glucose to make energy in the mitochondria. When insulin resistance develops, glucose has trouble getting into the cells efficiently. So even though there's plenty of fuel in the bloodstream, your cells are functionally underpowered. It's like having a full gas tank, but clogged fuel lines. This is where it gets interesting. People with early insulin resistance often feel exhausted and hungry at the same time. That combination doesn't make sense unless you understand the metabolic mechanism underneath. Another commonly ignored symptom is increased hunger, especially cravings for carbohydrates and sugar. This isn't a willpower problem, it's a hormonal signal. When insulin spikes repeatedly, often due to refined carbohydrates and frequent snacking, blood sugar can drop more rapidly afterward. The brain interprets this drop as an energy emergency. That triggers hunger hormones and cravings, particularly for quick sources of glucose. So you eat, blood sugar rises again, insulin surges again, and the cycle repeats. Now, let's talk about something many Americans never connect to blood sugar at all: brain fog. Difficulty concentrating, forgetfulness, feeling mentally slow. These are often attributed to stress or aging. But the brain is one of the most energy-demanding organs in the body. It relies on tightly regulated glucose delivery. When insulin signaling is impaired and blood sugar fluctuates, the brain doesn't get consistent energy. Clinical evidence suggests that early metabolic dysfunction can affect cognitive performance long before diabetes is diagnosed. This is why improving metabolic health often improves mental clarity. It's not magic, it's physiology. Another subtle but powerful sign is increased abdominal fat, especially around the waist. This is not just about calories. Visceral fat, the fat stored deep around the organs, is hormonally active. It releases inflammatory signals and free fatty acids that worsen insulin resistance. At the same time, insulin itself is a fat storage hormone. When insulin levels are chronically elevated, the body is pushed towards storing energy rather than burning it. This creates a feedback loop. Insulin resistance promotes fat storage, and fat storage worsens insulin resistance. Many people feel stuck in this loop, despite eating less or exercising more, because the hormonal environment hasn't been addressed. Here's what most doctors don't always explain clearly. Prediabetes is not just a blood sugar issue. It's a whole body metabolic state involving insulin, cortisol, inflammation, liver function, muscle tissue, and even sleep. Speaking of sleep, let's talk about poor sleep and nighttime waking. People with early blood sugar dysregulation often wake up between 2 and 4 a.m. This can be related to drops in blood sugar during the night, which trigger stress hormones like cortisol and adrenaline to raise glucose levels. Those hormones also increase alertness, making it hard to stay asleep. Over time, poor sleep worsens insulin resistance, raising cortisol further and pushing the system into a vicious cycle. Sleep and metabolism are deeply intertwined. Another sign that's frequently overlooked is frequent urination and increased thirst at levels that don't seem extreme enough to worry about. In full diabetes, these symptoms are obvious, and pre-diabetes, they're subtle. Slightly more trips to the bathroom, feeling thirsty even though you're drinking enough water. This happens because elevated blood sugar increases osmotic pressure, pulling fluid into the urine. Skin changes are another underappreciated signal. Darkened patches of skin, particularly around the neck, armpits, or groin, known as acanthosis nigricans, are strongly associated with insulin resistance. Skin tags are also more common. These are not cosmetic issues alone. They're reflections of underlying hormonal signaling problems. And then there's slow healing. Cuts that take longer to heal, frequent infections, or gum problems can appear early in metabolic dysfunction. Elevated glucose impairs immune function and blood vessel health, reducing efficient tissue repair. Now, here's the part that matters most. Prediabetes is not destiny. Clinical evidence shows that early intervention through lifestyle, nutrition, sleep, and stress regulation can significantly improve insulin sensitivity. In many cases, blood sugar markers return to normal ranges, but timing matters. The earlier the intervention, the more reversible the process tends to be. So, how do you apply this knowledge in real life? First, consistency matters more than extremes. Irregular eating patterns, constant snacking, and late-night meals keep insulin elevated throughout the day. Creating predictable meal timing allows insulin levels to come down between meals, giving cells a chance to resensitize. Second, muscle tissue is one of the largest glucose sinks in the body. Resistance training improves insulin sensitivity by increasing glucose uptake independent of insulin. This is one reason strength training is so powerful for metabolic health. Third, sleep is not optional. Even one night of poor sleep can worsen insulin sensitivity the next day. Chronic sleep deprivation compounds the problem. Fourth, stress management is not a luxury. Chronic psychological stress elevates cortisol, which raises blood sugar and promotes insulin resistance. This doesn't mean stress is all in your head. It means stress hormones have real metabolic effects. Now, let's talk about common mistakes. One of the biggest is focusing only on fasting glucose while ignoring insulin levels and overall metabolic patterns. Another is relying on extreme diets without medical guidance, which may worsen stress hormones and backfire metabolically. And an important warning, if you have symptoms, a family history of diabetes, or abnormal labs, you should work with a qualified healthcare professional. So, what does the future look like if you address prediabetes early? Better energy, more stable mood, improved focus, reduced cardiovascular risk, better brain health as you age, and perhaps most importantly, a sense of control over your health trajectory instead of waiting for a diagnosis to force change. Prediabetes is not loud. It doesn't scare people into action, and that's exactly why it's so dangerous. Your body speaks in patterns long before it breaks down. Fatigue, cravings, brain fog, sleep disruption, these are not random. They are signals. The question is whether we choose to listen.